Welcome back to another episode of Christian Natural Health. Today, I'm very pleased to have Dr. Alan Bauman back with us again. Dr. Bauman is the founder and CEO of Bauman Medical, an international leading treatment center in the field of hair restoration. Dr. Bauman received his medical doctor degree from New York Medical College in Valhalla, New York, and underwent internship and residency training in surgery at Beth Israel Medical Center in Mount Sinai Medical Center in Manhattan before dedicating his expertise to the specialized fields of hair transplant surgery and the treatment of hair loss, with a particular focus on androgenetic alopecia or hereditary male and female pattern hair loss. Dr. Bauman has established himself as an authority in the industry. Welcome, Dr. Bauman. Thanks so much for joining us.
Great to be with you, Lauren.
Yeah, for sure. So I wanted to kind of begin by talking a little bit about, before we get to some of like the last steps of surgery and things like that. You told me when we were on air before we started here that you see a lot of patients virtually from all over, right? So to kind of
Absolutely.
begin trying to evaluate what are some of the underlying causes, what can we address that you can do on your own. So from the standpoint of male and female pattern hair loss, what are some of the underlying causes that you find besides genetics?
Right. So we know that there's typically a genetic tendency
Right,
towards hereditary hair loss, which is the
right,
pattern of hair loss that you would
right,
commonly recognize in men, receding
right.
hairline or thinning
Sure.
in the frontal zone for women, and then
Yeah,
maybe a recession of the hairline later on. In
sure.
men, it goes to total baldness. In women, it typically does not. And it typically preserves the hair on the sides and the back of the scalp. But one of the things that I've learned over nearly 30 years in the field of hair restoration is
Yeah.
that the hair follicle is a very strong barometer for overall health and wellness.
Oh,
And so,
okay.
what we know is that the hair follicle is one of the most highly metabolic cell populations in your body, and it's constantly doing something that we can visually see. So,
Uh,
just like we see aging and other influences of lifestyle on our face, right? On our skin, maybe it
sure.
wrinkles, it looks dry,
Yeah.
it could be inflammation or acne or other things that could happen on
Hmm.
our skin that's very visible. Well, hair follicles also are responsive to everything from nutrition to lifestyle habits like poor sleep cycles or poor nutrition or malabsorption
Hmm.
or overall body inflammation. Certainly, scalp health, local inflammation can disrupt the hair follicle function as well. But then there's medications that people may be on, everything from blood pressure medications to cholesterol medications to mood modulators, which are so common these days.
Yeah.
These are all things that can really dysregulate the hair follicle function.
Hmm.
Whole body inflammation, stress, and nutrition are really killers
Yeah,
for many people's health and wellness, and certainly the hair is responsive to that as well.
right. And so when you're talking to somebody who's experiencing this, how do you start to figure out what's the issue for this person? Is there like a missing building block in terms of micronutrient, or is it like macronutrient issues, or is there maybe toxicity that we need to investigate? How do you parse that?
Well, yeah, all the above, but it really
Okay.
starts with a very broad conversation of what's going on in the family, right? So that's where
Okay.
we identify the genetic risk factors, what
Right. Right.
exactly they're experiencing, because there's a lot of different types of alopecia, right?
Right.
Alopecia is just the main term for hair loss.
Sure.
Sometimes patients will come in with a shedding phase. And so if they
Mhm.
have a sudden shedding phase, then that's totally different
Right.
than, let's say, a receding hairline or a thinning spot happening in the crown in a male in their 20s, let's say.
Right. Yeah.
And
Yeah.
so, someone in perimenopause or menopause, a woman's going to have a lot of different other factors that could be influencing not just the amount of hair that she has on her scalp, but the quality of that hair as
Yeah.
well. And so, we can see texture changes, hair color changes, obviously. And
Right.
so, how do we get down into it? Well, we have a broad discussion of lifestyle factors. I want to know their medical history. Have
Sure.
they had any scalp health issues?
Sure.
What is their nutritional status looking like? Are they on a restrictive diet? Are they on a weight loss drug or weight loss
Mhm.
program? Have they lost weight? Have
Right.
they had, in the days gone by, have they had COVID or other severe
Sure.
infections, fever,
Right.
hospitalization, surgeries like general anesthesia? If
Hmm.
you're a woman of childbearing age, one of the things that we look out for is PCOS, polycystic ovarian syndrome.
Yep.
Younger men, we're looking at, are they abusing creatine or performance enhancing drugs? Are
Mhm.
they smoking? Are they using toxic toxins? Are they exposed to toxins in their work or lifestyle?
Yeah.
So there's a lot of things that we want to cover.
Yeah.
And, I'm not, I mean, I wouldn't say I'm a functional health physician, but I am aware of this, having been
Sure.
involved with alternative and complementary
Right.
therapies and a
Yeah.
functional approach to health and wellness
Right.
for my entire career.
Yeah.
Aside from being trained in surgery,
Sure.
I've been a member of the American Academy of Anti-Aging for nearly 30 years. So,
Yeah.
we kind of get an idea from that story
Right.
what is going on, and we've left out mold toxicity
Yeah.
or chronic diseases and things such as that
Mhm.
can really, all of these things are really
Sure.
nasty for hair follicle function, unfortunately.
Yeah, yeah. And so as you're talking, I'm thinking about in naturopathic medicine, we have this idea of inside out, top down. So when your body is trying to get rid of some sort of internal problem, like when it's trying to detox, typically it's
Mhm.
going to push it as far away from your internal organs as it possibly can get. And that would include skin and presumably hair too. So you mentioned that this is a barometer of internal health. What does that usually indicate to you? Like, are there first places that you go in terms of functional investigation and like specific nutrients, specific toxins, anything like that, that you look
Well,
at first?
yeah, I mean, if we're talking about internal health, first, I mean, of course, scalp health is critical.
Right,
So that's
right,
easy to look at, right? So you're in the consultation,
sure,
you've progressed from, let's say, a virtual start or a phone call or just some photos and or messaging and so forth. Now you're in the office, we're doing detailed measurements of your scalp, we're looking under the microscope, and we're
sure.
making sure that there's nothing specific
Mhm.
in terms of inflammation, dandruff, itching, irritation, folliculitis, or acne of the scalp. All of these things seborrheic dermatitis, you name it, could be disrupting the hair follicle function.
Sure,
Once we've kind of cleared that, then we're talking more about nutrients and fuel,
right.
right? It's
Mhm.
clear that if you're protein deficient and either on purpose, like let's say, you're trying to lose weight,
Mhm.
or maybe you have a harsh restrictive diet, vegan or vegetarian, not that there's anything wrong with that, but it
Right,
may be harder for you to absorb enough protein or metabolize that protein
sure,
into
yeah.
keratin, which is what we need to grow hair and fingernails, by the way, and everything
Right.
else in the
Yeah,
body.
right.
So we're talking to patients about nutrients and fuel.
Mhm.
And it's one of the reasons why I developed actually a supplement line.
Mhm.
Maybe I was one of the first hair doctors, 30 years ago to develop a supplement line that
Mhm.
specifically targeted deficiencies that we'd uncovered in our
Mhm.
patients.
Yeah.
So it might include, the bovine collagen peptides. It might include a multivitamin, a B
Building blocks. Yeah.
complex for younger men that don't have never taken a vitamin before. Hey,
Mhm.
wake up! We got to get things
Sure.
going along here.
Will be the time.
Um,
Right.
and there's specific nutrients like biotin. We also use probiotics often if there's
Mhm.
some indication for it
Right.
with the gut microbiome,
Mhm.
and maybe we've uncovered some dysregulation there, or there's some history of some issues there.
Mhm.
Specific herbal treatments such as ashwagandha, curcumin turmeric, things like that, and the mixtures that you might commonly see with saw palmetto and so forth. It gets a little bit more into like what are we exactly trying to
So,
protect the follicle
yeah.
from,
Right.
rather than feed to the follicle.
Yeah. Yeah.
Right. So that's where I kind of place the nutrients and fuel and the herbs, if you will,
Yeah.
in that strata
Mhm.
of guidance for our patients.
Right. And so with respect to the DHT, the dihydrotestosterone that tends to be kind of that's the most common underlying cause, right, for the male pattern and the female pattern here. So I know that there's a genetic component, but for somebody that, doesn't have a problem and then suddenly they do, is there a reason for that shift later on? I mean, for women, a lot of times that happens around perimenopause, menopause. But is there a particular, like, are there other things that you can identify that maybe shift that enzyme to shuttle the testosterone down that pathway?
So, yeah, let's just back up for a minute.
Yeah.
DHT, dihydrotestosterone, we know that that is the primary trigger for male pattern hair loss.
Yeah.
And how do we know that? Well, if we deliberately reduce the
Block it.
production of
Yeah.
DHT in men,
Okay.
over 60% less production, we know that they have a 90% chance of keeping their hair,
Right.
right? So that's like very, very well defined,
Yeah.
hardcore, double-blind randomized crossover studies that were done back in the 1980s, 90s, and so forth.
Mhm.
So DHT we know is the primary trigger for men. Now, are androgens an important concept for women to understand? Absolutely. As I mentioned a few moments ago, PCOS is androgen sensitivity in women. There's a component there, right? They tend to have excess hair, hirsutism. They tend to have excess acne and breakouts on their face, and they also have hair losses, and it also may include weight gain. So there's a whole constellation of symptoms that are
Right.
androgen related.
Mhm.
And so we know that that androgen sensitivity is maybe what's triggering hair loss in those women. And we
Mhm.
also know today from observation very clearly that
Mhm.
if you take a woman in postmenopause and you replace hormones,
Mhm.
right? estrogen, progesterone, and also testosterone. And if you do too much testosterone in those women, they tend to get what looks like male pattern hair loss.
Right.
It's
Yeah.
really just aggressive female pattern hair loss, but
Mhm.
it can happen fast. And
Sure.
if they're on pellets or things like that, where really their testosterone is skyrocketing,
Yeah.
testosterone is converted into DHT. And
Mhm.
even if you have just a little bit of sensitivity to the DHT at the follicle,
Mhm.
you can create a lot of hair loss.
Okay.
So, is there something that happens in perimenopause or menopause that shifts that balance? Well, yeah, that's probably what's going on. That we're
Sure.
seeing more androgen dominant situations happening in those years of life.
Yeah. So what you just mentioned about the receptor becoming more sensitive to DHT is really interesting. No? Did I miss?
It's not well. What you inherit is that
Okay.
sensitivity. So
Okay.
you're born with that sensitivity.
Yeah.
How many receptors and how powerful are those receptors going to be?
Right.
And
Okay.
then are you overloading those receptors if you're
Sure.
adding the testosterone, or is
Mhm.
there something that used to compete with the testosterone or DHT? I really should
There now.
say
Mhm.
at that receptor. So
Mhm.
it's not something that's changing at the level of the
Right.
receptor in terms
Yeah.
of what we know today.
Sure.
It's just what you're doing, exogenously, adding the hormone optimization or other things happening.
Right. So for somebody that like male or female pattern hair loss, if we're doing blood testing and we do not see elevated levels of DHT or free dihydrotestosterone, but they still are exhibiting the patterns, what do we think might be going on in those cases?
That's actually 100% normal. It's usually
Yeah.
not elevated DHT
Ah, okay.
unless you're supplementing testosterone.
Okay.
So actually, the level of the DHT
Yeah.
is not really the concern
Right.
in terms of your susceptibility to
Okay.
male or female pattern hair loss.
Okay.
You could have two brothers that have the exact same similar DHT level.
Yeah.
One is going bald by the time he finishes high school or college, and the
Uh-huh.
other one is having his hair until he's in his midlife. Why
Interesting.
is that?
Yeah.
They have the exact same DHT.
Uh-huh.
Well, it's the sensitivity to the DHT. It's
Receptor.
the receptor genes
Sure.
that we know. And so how do we know that?
Yeah.
Well, we can do genetic testing and we
Okay.
look at metabolic pathways. We can
Okay.
also look at androgen receptor
Mhm.
uh, risk factors, and that can
Mhm.
actually determine between the two brothers
Yeah.
before they have any hair loss,
Yeah.
which one is most likely to get the hair loss situation happening
Wow. How
faster.
interesting.
Same thing in
Okay.
women.
Right. And so most of the oral medication approaches to male and female pattern hair loss are addressing that DHT, right? The conversion of testosterone to DHT or no?
Well, some. Okay,
Some. Okay.
so what you're talking about is the FDA-approved medication,
Mhm.
finasteride, which was
Right.
originally approved as Propecia, about a milligram for men
Yeah.
back in 1998. It was
Mhm.
originally a prostate drug, but
Mhm.
Merck knew full well that by lowering DHT, they're going to treat hair loss,
Right.
and so. Um, that is part of a discussion with
Okay.
any man that's experiencing male pattern baldness.
Right.
Now, oral finasteride is normally safe. 98% of patients have zero side effects reported.
Mhm.
90% of guys maintain the hair that they have, meaning they look the same or better in the long run.
Mhm.
2 out of 3 on the daily dose will get some regrowth, maybe not full regrowth, but some.
Mhm.
But the concern is that 2%
Mhm.
experience sexual side effects like decreased libido or mild erectile dysfunction, which are mild and temporary if they occur.
Yeah. Okay. And with respect to adding in minoxidil with finasteride, how do these work together? They're usually prescribed together more often than not, right? So,
Absolutely. So
yeah.
minoxidil was the original, the OG
Mhm.
treatment for male pattern baldness.
Yeah.
And of course, it's been also FDA approved as a topical for
Right.
women as
Yeah.
well. That was the old Rogaine.
Mhm.
Today, we see less patients choosing topical minoxidil
Mhm.
under medical supervision. And the
Okay.
reason is because now we can compound minoxidil at a microdose level for
Mhm.
both men and women in a very safe way. That's
Mhm.
not going to tank their blood pressure down and
Yeah.
cause headaches or dizziness,
Mhm.
although it could happen if you do too
Right.
much of it or you're sensitive to it.
Mhm.
But minoxidil can be a game changer,
Okay.
non-hormonal,
Yeah.
directly causes the follicles to stay in the growing phase, which is
Mhm.
really
Okay.
important because
Mhm.
miniaturization of the follicle shortens the growth cycle, makes the hair thinner. And
Uh-huh.
so if you can turn follicles on and keep them in a growing phase, that's
Right.
minoxidil. And
Yeah.
that's totally a different mechanism of action
Mhm.
than finasteride. So
Mhm.
when you add those two together, you get a synergistic response.
Got it. Okay. And so for someone who either doesn't want to go to the medications or can't because of side effects or something along those lines, I know the supplements that are probably best known are like saw palmetto, and I think PyGM is another of the common ones. So
Sure.
those mechanistically, how do those compare?
Yeah, so just there is an in between. So some
Okay.
patients may not want oral finasteride, and we can use a topical version of that.
Okay.
Just be aware. Sometimes we might do genetic testing to see if they're likely to respond to minoxidil well or not. So that sometimes guides us a little bit. But yes, you're absolutely right. Saw palmetto is a well-known anti-androgen,
Mhm.
and it can be used in both men and women. We
Mhm.
have topical versions, for example, in our hair care products. We also have oral versions in curated nutritionals like Nutrafol, which everybody has heard of.
Yep.
The new Express gummies, which also contain some saw palmetto. You could also dose it on the side
Right.
and fluctuate it. So
Right.
sourcing good quality saw palmetto is not simple. Like so, Amazon saw palmetto
Probably not
is
good.
like the Wild West out there
Sure.
sometimes. And
Yeah.
what I've heard in the research is that it says saw palmetto on the bottle, but guess what? There's no saw palmetto in the capsule.
Oh man.
So
Yeah.
buyer beware out there.
Sure.
Choose your herbal organic supplements carefully. In other words,
Sure. Yeah,
yeah.
absolutely. And with respect to the topicals, so if you're are you typically compounding, or is it like a pre-made formula that you typically go for in that situation, or how does that work?
So, yeah, the reason
Yeah.
why compounded topicals work so much better, and this is not something new, this is 20 years of
Yeah.
knowledge here that we're talking
Mhm.
about,
Yeah.
is that the over-the-counter minoxidil has to be exactly the same as the original FDA-approved version
Oh,
with minimal
interesting.
manipulation.
Okay.
So that's why Rogaine and all the other 100 knockoffs or 1,000 knockoffs that you see in the supermarket are just
Yeah.
nasty.
Interesting.
And
Okay.
there's also a genetic component to that as well, that you may not have the enzyme to convert the minoxidil into minoxidil sulfate. So that
Uh,
might be one of the reasons why about 30% of people don't get a good response.
sure. Okay.
And then the rest, maybe not even using it correctly. Most people think, oh, just once a day is enough. No, you got to
Sure.
use it twice a day.
Yeah.
So compounded medications like Formula 82M,
Mhm.
which is minoxidil plus other ingredients like tretinoin, fluocinolone for inflammation,
Mhm.
um, has a base, and the base is the
Mhm.
critical component that is non-greasy,
Mhm.
quick drying, and fast absorbing. And
Mhm.
so people say, many pharmacists get very, strategic. They're like, oh, my compound has all these different great ingredients in the
Right.
recipe. And
Uh-huh.
then they still mix it in a greasy, gooey, nasty excipient
Uh,
base.
sure. Okay.
So,
Yeah.
and that never works. So 82M is a hair science product that's
Uh-huh.
licensed to pharmacists,
Uh-huh.
and that recipe is actually secret. Like I don't know how they make it
Yeah.
actually,
Yeah.
but I just know that patients have a much better
Wow.
result with it because there's
Right.
fewer side effects and
Yeah.
less impact on their hairstyling.
Sure. And does that go through regular pharmacies, or do you have to get that one compounded as well?
You have
No.
to get that compounded, and there's only one pharmacy in the US and two in North America that are actually allowed to compound that exact
Wow.
formula.
Interesting.
Yeah.
Okay. So,
Yeah.
and I'm curious, so the tretinoin addition in there, is this just to try to stimulate the skin to heal, or what's the thought process there?
Yeah, so
Yeah.
here's the magic of tretinoin. And years
Yeah.
ago, we weren't quite sure, but we did know that it worked better when you combine minoxidil and tretinoin. And we
Uh-huh.
thought maybe it had to do with penetration, and there's some
Uh-huh.
research to support that. But
Right.
today we know, going back to that enzyme that converts minoxidil to the active metabolite, which is minoxidil sulfate
Right.
in the skin,
Mhm.
you need sulfotransferase enzyme. And
Okay.
that's an enzyme that we're all born with, but
Uh-huh.
everybody has different levels of activity in that
Right.
pathway.
Uh-huh.
Some people have a super highway, some people have a little dirt road,
Uh-huh.
if you
Okay.
catch my analogy.
Sure. Yeah.
And so if you're one of those folks that has like a dirt road instead of a super
Mhm.
highway and sulfotransferase activity,
Not gonna work as
then
well.
the over-the-counter Rogaine is not going to work that well for you.
Same.
And
Okay.
what we've learned is that tretinoin
Uh-huh.
is one of the major stimulators or boosters
Huh.
of the sulfotransferase pathway.
Interesting. Is it a
So
cofactor?
that,
It's vitamin A, right? Yeah. So,
yeah,
okay. Hmm.
retinoic acid, essentially,
Yeah.
tretinoin. Yeah.
Okay.
And so,
Yeah.
how does that, how exactly does that impact the sulfotransferase enzyme? Probably beyond the scope of our conversation, but it is one, it's not, if it's not the most powerful way to do it, it's certainly one of the most powerful ways.
Yeah. And I've heard of adding in, as you're mentioning, the sulfur aspect of it, MSM topically. I've heard some people using DMSO. I'm not sure if you want to weigh in on that part of the conversation. How does that play in, the specific addition of sulfur?
Sure. So as long as you're not allergic to those kinds of ingredients and
Right.
you're not
Yeah.
sensitive to the
Right.
particular excipients in the topical
Sure.
base, essentially,
Right.
then many of these things can actually potentiate the
Mhm.
passage of the medication, whether it's minoxidil or even finasteride. And today, even dutasteride can be
Yeah.
compounded as a topical
Mhm.
into the skin.
Right.
So, yeah,
Right.
those are all great additions that you should use under the guidance of a physician who's familiar with those things. Because before you go all the way down the road to get the most complicated and expensive compounded medication,
Uh-huh.
you may want to do that, $200 genetic test just to
Sure.
see if you really need it or not.
Right. Yeah, absolutely. So,
And that's
one.
something we actually provide through the website,
Excellent.
and also to our patients who come in if they need it or want it or we feel it's indicated, we might recommend that genetic testing,
Yeah.
which looks at a variety of different pathways, not just pharmacogenomic, but also nutrigenomic as well.
Sure. And for somebody who's got more sensitive skin, I know that there's some formulations out there that have alcohol, some that don't. What's the reason for putting alcohol in there? Is it just a solvent to try to increase delivery, or what's the thought process there?
So minoxidil is an organic compound,
Yeah.
chemistry wise, organic chemistry is an organic compound. So what that means is that you can't dissolve it in water. You have to dissolve it in an alcohol. And
Uh-huh.
so whether it's propylene glycol, which was the original nasty ingredient
Yeah.
in the Rogaine, or
Right.
something more sophisticated, you need an alcohol, a like dissolves like, so to speak. So for minoxidil to really work, you
Yeah.
have to be able to dissolve it, and you can't dissolve it in an aqueous or water-based solution. You have to use something else.
Okay.
Now, peptides and proteins are a different story. You can use, if you want to use a peptide on your scalp, you
No
can use an
problem.
aqueous solution, no worries at all.
Hmm.
Some of the growth factors and other really super sophisticated molecules that are now available in topical solutions, not only for deployment into the scalp,
Hmm.
peptides and such in the office, but also for home use. Many of those have alcohol-derived components
Hmm.
or are encapsulated. So they're encapsulated with a bilipid layer, like little, almost like exosomes, pseudo exosomes, if you
Hmm.
will.
Okay.
Yeah.
And so once somebody's kind of progressed beyond that, there's a number of other things they can do before we get to the surgery step.
Oh,
I
yeah.
know red light therapy. Can you comment on this? How well does it work? How many people does it work for? How long does it take? All of that. Yeah.
Sure. So when we say red light therapy for scalp, we're not talking about those little LED masks that you would
Right.
use for
Yes.
your face. Okay. So
Sure.
we have to understand that there's a power density level that's a threshold that you need to surpass if
Yeah.
you want good results. And
Mhm.
unfortunately, many of the laser light devices or laser caps that you see on the market, especially Amazon, and just use that as an idea,
Yeah.
are very, very much underpowered.
Mhm.
Not enough power to really do much of anything,
Yeah.
unfortunately. Or you have to spend an inordinate amount of time to
Sure.
get exposure to the scalp.
Sure.
So
Yeah.
make sure your laser caps are laser based
Mhm.
and that they are physician prescribed and recommended, and that your doctor understands that this shouldn't be some big plastic dome on
Mhm.
your head. Okay, that should be something more sophisticated. So red light therapy does work. We have the double blind randomized clinical trials and the meta-analysis
Mhm. Yeah.
published in the literature. So
Yeah.
we're very clear. The mechanism has been elucidated
Mhm.
at Harvard Center for Photomedicine. Dr. Michael Hamblin
Mhm.
did much of the research that shows that the photons of light are absorbed at the cytochrome C oxidase, which is a
Mhm.
part of the electron transport chain in the mitochondrial membrane. And that what does that do? It ramps up ATP. ATP is the energy currency of the cell.
Yep.
And so we talked about the most highly metabolic cell population in the body. If we provide more energy, we're going to get better hair growth.
Sure.
Red light can also be slightly anti-inflammatory, and it can also increase blood flow dramatically to the
Yeah.
scalp. So,
Right.
a turbo laser cap is our premier primary device. It
Uh-huh.
has a high density of power delivery. It has um, over 300 diodes. It treats the back of the scalp where you have the largest vessels that feed the top of the scalp. And
Mhm.
it's a highly portable and powerful device. So that's a device that packs flat for travel, which is really, really nice. So the Bauman
Oh,
Turbo
very
Laser
nice.
Cap is
Yeah.
what we typically recommend. There are other ones that are out there that are okay, but you
Mhm.
typically need to spend a lot more than 5 minutes with them,
Sure.
which is
Yeah.
the recommended dosing time daily with the Turbo Laser.
Gotcha. Okay, so 5. Wow. And how long does it typically take people to see results if they're going to when they're using that?
Yeah. Any treatment that you start today, you're going to
Mhm.
have a full head of hair tomorrow, right? No, that's not how that
Right.
works. Sorry.
Right.
Unfortunately, it doesn't work like that. Hair grows at a very specific rate, pretty close in all humans, about a third of a millimeter a day, which is about a quarter to a half inch a month, about a centimeter a month is what you get.
Mhm.
So if all of the hair on your head started to improve dramatically from laser light therapy, you still wouldn't see it for months on end.
Yeah.
So at 90 days, we can measure typically the results. So we do that in the office, both physical measurements and digital measurements of the scalp. And we have probably 6 different types of tools that we might use for that. And
Mhm.
then visually, you would see those results or feel the results looking in the mirror, feeling your ponytail volume months later. So
Mhm.
6 months to 12 months to really see a full result from any change in your therapy. And
Right.
that's where people go wrong. They're
Right.
like, well, I used Rogaine for a month and it didn't do anything.
Sure.
Well,
Yeah.
that's like doing a half a push-up one day. That's it.
Mhm.
That
Yeah.
didn't work. Yeah, that you've got to be a little bit more consistent than that.
Sure. Absolutely. So, and then what about PRP with microneedling? How often does that work? For how many people does it work statistically?
Mm.
For who does it fail? That kind of a thing.
Yeah, similar warnings, like with the lasers. So
Right.
everybody, all of a sudden, every medi spa has PRP,
Yep.
and they love to provide this like low quality PRP. You have to come back every month for the
Right.
treatment. It's may or may not be combined with anything else, and
Mhm.
so this is a very, very inefficient and poor quality PRP. If
Yeah.
your dermatologist or medi spa says we're going to do this treatment on a monthly basis for a period of time,
Yeah.
you know that PRP is old school.
Mhm.
And 20 years ago, we learned from the orthopedic surgeons how to do a dual spin process for PRP to
Mhm.
create the exact concentration tuned for each patient to
Mhm.
get the optimal biologic response at the level of the scalp, which is new blood vessel formation and movement or mobility of the stem cell populations, which is critical for hair regrowth.
Mhm.
So there's a very specific formula. I'm going to give it to you right now.
Mhm.
1.5 million platelets per microliter.
Mhm.
That's the dosing strategy.
Okay.
That's like telling you how many milligrams of this particular herb you need to take per day. If
Mhm.
you don't know how many you're taking,
Right.
then you don't know what's going on. You may be taking a placebo dose.
Exactly. Yeah. Right.
So, microneedling on its own can grow hair,
Right.
but microneedling plus other growth factors,
Mhm.
extracellular matrix, biologic material, plus the platelets can be a powerful hair regrowth treatment. And
Mhm.
that could last, one treatment can last an entire year. So
Mhm.
in my practice, 10 to 14 months of boost is what you're going to typically get from a standard PRP.
Yeah.
And we can prolong that even further if we use synthetic scaffolding like PDO threads. If
Mhm.
we use exosomes, we can get a little bit of a stronger push on the hair follicle. So there's a couple different things that we can add
To
to the
boost it.
PRP if we want.
Yeah.
So I would just say, not all PRP is created equal, just like grandma's sauce. Not all the same. Your grandma's sauce probably not
Sure.
the same as my grandma's sauce.
Gotcha. Yeah. No, absolutely. And what are some of the new things on the horizon that are maybe just now developing in the field of hair regrowth?
Yeah, so some pretty exciting things. I mean, obviously, hair transplantation has changed a lot over the years.
Right.
We've gotten from the old style, pluggy, painful
Right.
procedures
Yeah.
into single follicle implantation. We
Yeah.
now can harvest those grafts without cutting a strip of scalp. So they're minimally invasive
Okay.
now. So
Yeah.
it's quicker healing, faster recovery, no narcotic pain medications. You're not cursing the surgeon that night after the surgery anymore.
Right. Uh-huh.
Less restrictions on the recovery phase, a lot quicker on the back end. And of course,
Sure.
naturalness is the key. So there's artistry and technology.
Yeah.
We can now harvest the follicles without shaving your head. So that's
Ah,
really important
okay.
for women who are now great candidates for hair transplants. They may not even have been told they were a candidate before.
Right. Yeah.
We never shave the recipient area.
Uh-huh.
In the back of the scalp, if we're doing a large case for some our male patients, we might shave a large area. For
Yeah.
women, we can now harvest without shaving, or
Mhm.
we shave a little tiny zone hidden underneath your hair, and you're fine.
Right. Yeah.
Um, but the exciting things around the corner, I would say, are in the realm of regenerative medicine, right? Using the new knowledge and new research on growth factors and peptides and deploying them into the scalp.
Yeah.
Some therapies we have in the office are lunch break procedures like the TED, which pushes peptides through the skin using ultrasound. We
Oh,
also have a
okay.
laser that's FDA cleared to stimulate
Uh-huh.
hair growth, a non-ablative fractional laser. So there's no crusting or burning on the skin. There's just some heating underneath, which improves hair growth, and that's a great device.
Right.
And then down the road, what we're looking at is the potential, hopefully, for some kind of hair follicle cloning or hair follicle multiplication.
Wow.
So, that's a pretty exciting new development. I was just up at a research lab in Boston
Yeah.
at Boston's Children's Hospital. Harvard researcher Carl Kohler is working on hair follicle organoids, skin organoids, which are growing hair. And
Yeah.
so these are the first primordial steps towards
Uh-huh.
growing hair follicles in a laboratory.
Oh, wow. That's amazing. So for the TED, would that be something that was in addition to surgery or instead of? Is like a
So
step before? Yeah.
TED's a lunch break procedure, more like fertilizer for the existing hair,
Ah,
right?
okay.
Which
Yeah,
is the
yeah.
key component, right? You want to get your
Sure.
existing hair to be protected and enhanced if you can. And
Yeah.
that's where growth factors and peptides such as, copper tripeptide, copper GHK,
Yeah.
thymosin beta 4,
Mhm.
and there's plenty of others, PTBDBM, methylvalinate, things like that are included in those cocktails, if you will, to push through the skin
Sure.
into the hair follicle zone so that they can
Yeah.
stimulate hair regrowth.
Gotcha. And so for somebody that has had the follicle, individual follicle moving from one place to another surgically,
The
um,
transplant, yeah.
thank you. So when once that's happened, is there a likelihood once it's in the new location that it might also be sensitive to the DHT like the original hair that was in that location? Is that a concern?
Well, the beautiful thing
Yeah.
about hair transplantation and
Uh-huh.
really the tenet, the
Yeah.
backbone of the
Yeah.
entire field is that the hair around the sides and the back is
Uh-huh.
roughly, mostly
Uh-huh.
immune to the effects of DHT. So
Interesting.
those
Okay.
follicles, just like when they're coming from Brooklyn, you put them into the
Right.
new location, they don't lose
You're
their
still
Brooklyn
fine.
accent so
Okay.
easy.
Sure.
Yeah, so
Yeah.
they maintain their DHT
Their
resistant
identity. Yeah.
profile when
Right.
they're in the new location.
Right.
Now, but that's why you have to have the correct diagnosis. Because if, let's say, the problem was some kind of scalp health issue or inflammation or
Okay.
autoimmune condition,
Sure.
which is also, raging now. There's an epidemic of
Oh, yeah.
scalp conditions that are non-hormonal
Right.
that can attack the follicles, especially in women.
Yep.
And if you transplant into an area that's got active inflammation,
Of
it's
course.
not going to grow well.
Sure.
And sometimes, even if the inflammation is cooled down, it could stimulate back up again and destroy the transplants. So,
Mhm.
making sure you have the correct diagnosis is really key,
Right. Yeah, that makes sense.
critical.
Gotcha.
But so the problem
Yeah.
is that not that the transplants don't
Yeah.
aren't permanent; it's your
Right.
other hair
Sure.
that
Yeah.
needs protection, and that's
Right.
why the other medical therapies dovetail
Yeah.
with the transplants.
We want to make sure we're looking at the root issue so that we're not like just treating it at the very surface level. Absolutely. Yeah.
Correct, absolutely.
Yeah. So, what have I not asked you that you want to make sure you leave with our audience?
Wow. Well, I think our take home message is
Yeah.
that time equals follicles.
Mhm.
And we say that because every day, week, or month, or year that you're not actively treating a hair loss condition
Mhm.
means that it's likely getting worse.
Mhm.
And hair loss can kind of sneak up on you. You can lose a lot of density and quality of hair without it really being noticeable to the casual observer.
Mhm.
And this science is very, very solid. Like you could literally pluck out 50% of the hair in one zone and it still looks about the same.
Yeah.
But if you start to dip below that number of hair follicles, like if you lose more than 50%, all of a sudden it's thin to the naked eye.
Right.
So if you're sensing some loss, it may
Mhm.
not even look like there's loss. And your
Right.
friends and your family and your hairdresser and your barber are saying, you're fine, whatever, you're doing okay. Well, microscopically, they may be wrong.
Right.
Microscopically, you might be losing a lot of hair. So I
Mhm.
will say to anyone who is experiencing or think that they might be at risk for hair loss, whether it be hereditary or other causes, just get an evaluation.
Mhm.
Please just look into it. Look into all the health issues that we just talked about, but get a density measurement.
Mhm.
Go to a physician, and it may not be a dermatologist because the derms don't have a lot of this equipment, honestly,
Right. Yeah.
unfortunately. They may
Mhm.
have a little microscope, but they don't have a way to measure your hair
Sure.
density and hair caliber
Yeah.
like a hair metrics device, which is one of the
Right.
things that we have.
Yeah.
And that's going to elucidate exactly what's going on at
Mhm.
the level of the scalp. So what we would do, compare the back
Yeah.
to the areas that are at risk where you think you might be thinning. And we
Right.
know if there's a little bit of loss, we know that there's a chance for further loss.
Gotcha. Okay.
And that's when we got to start therapy. So time equals follicles. Get evaluated and start your treatment early before you think you need it.
Absolutely. So where can people go to learn more about you and about your clinics?
Yeah, well, people can find me anywhere on all the social media platforms, but really the best place to start your journey is baumanmedical.com.
Mhm.
Bauman medical.com has thousands of pages of information that I've written personally over the past nearly 30 years of being in the field.
Wow. Yeah.
You'll see information such as hundreds and hundreds of videos that are out there, thousands of patients who have been treated, have allowed me to use their photos so you can peruse patients that look like you
Yeah.
or ones that don't and see what it looks like. You can see everything from the nuanced procedures like the long hair, non-shaved hair transplants to things like eyebrows and eyelashes to
Wow.
my thoughts on scalp health and what we should be doing to rectify that.
Mhm.
So, baumanmedical.com, you can also just ask a question right there. You can DM me on social media and I'll get an answer out to you. And but most patients do start their journey there at baumanmedical.com even before they come into the office in person. They can start their evaluation virtually, and we can do it just as a Zoom call, video
Yeah.
call, or FaceTime, if you will. Those types of things are very, very helpful to kind of get an understanding of what exactly is going on and how aggressive we need to be.
Right.
The most important thing, don't panic.
Mhm.
We've got this. We can treat it.
Yeah, excellent. Very good. So thank you so much, Dr. Bauman. This has been really encouraging and insightful. Appreciate your time.
Lawrence, truly been my pleasure. If any questions come up from your followers or audience or listeners, please pass them along. I'm happy to come back and answer those questions at any time. But it's great to be on again with you.
Awesome. Thanks so much.